Thank you for inviting me. I've been asked to talk to you about heart rate variability and patients who have experienced trauma. And my disclaimer for this talk is that heart rate variability does my head in. And why do I say that? And this figure is a visual representation of the stress system and its components. The circle made up of the red, blue, and purple lines represents the autonomic nervous system, the nervous system that innervates the organs and tissues inside the body. The red codes for the sympathetic system, sometimes termed fight and flight. The blue codes for the restorative parasympathetic system, sometimes termed rest and digest. The purple codes for the defensive parasympathetic. The purple component activates alongside the red. And heart rate variability attempts to measure the robustness of the blue line, the motor component of the restorative parasympathetic system. But as you can see here, the autonomic system interacts with all other components of the stress system. And the task of this larger system is the maintenance of homeostasis, the balance of body systems that allows us all to maintain life. The stress system also responds to threat and danger, enabling the body to react to the challenges of life, including the challenge of trauma. So you can see that when we talk about heart rate variability, we're trying to segment off a small subsystem, the blue line in the circle, that sits within a large complex system. Now let's zoom in on the autonomic nervous system. This functional representation shows you the basics. You have afferent nerves, the figure on the left, that go from the tissues of the body to the brain. They carry all sorts of information about the state of the body to the brain. The red symbolizes the sympathetic part of the system, and the blue, the restorative parasympathetic. The brain processes this information. Then you have efferent nerves, the figure on the right, that go from the brain to the body. These are visceromotor nerves that adjust a variety of physiological functions to maintain homeostasis and to respond to threat. This includes regulation of the heart, the blood vessels, the gut, the bladder, the adrenal gland, and many, many other physiological functions. And normally there's a balance between the blue and red. The two systems work together across body domains. The vagal nerve is the main nerve of the parasympathetic system. In this talk, I often use parasympathetic and vagal interchangeably. And in my diagrams, the restorative parasympathetic is always coded blue. So now let's zoom in on to the heart. So heart rate variability is an approximate measure of the strength of the blue line to the heart, the activity of the restorative parasympathetic vagal innervation to the heart. Because it's difficult to measure the activity of the restorative parasympathetic innervation to the rest of the body, to the gut, to smooth muscle in the blood vessels, and to various other parts of the body, heart rate variability is used by some as a proxy measure for parasympathetic innervation to the body as a whole. And the assumption is that when the blue activity to the heart increases, then blue activity to the body as a whole also increases. And this assumption is an oversimplification. It tries to make a very complex system simple. This is a stylized diagram of the parasympathetic system. And contemporary clinicians use a broad range of technology-based innovations to innovate the parasympathetic system to increase health and well-being or to promote healing. So surgically implanted vagal nerve stimulators instigate regular pulses in the vagal nerve in the neck. And in Australia, they're approved for treatment-resistant epilepsy. In the US, they're also used for treatment-resistant depression and to promote healing during rehabilitation post-stroke. So in this scenario, clinicians stimulate the vagal nerve, but they do that for the flow-on effects to the brain itself. Topical vagal nerve stimulators are approved in Australia for the treatment of migraine. They also stimulate the vagal nerve at the neck level so as to achieve the flow-on effects that occur in the brain itself. And in the US and Europe, approval indications are much, much broader than we have here. Other non-invasive vagal stimulators use gentle electrical or vibratory impulses to activate the branch of the vagus in the ear. In the case of the Safe and Sound protocol, modified music is used. This music utilizes the soothing tones within the human voice range. The goal here is to stimulate the vagal nerve in the ear so as to send soothing information to the brain, so as to change autonomic processing in the brain, so as to increase heart rate variability and parasympathetic activation to the body as a whole. Now, the evidence base for auricular devices is yet to be established. We do not know which of these devices are most helpful and which are not. And currently, STARTS is running a study looking at the utility of the Safe and Sound protocol in refugee children. And then there's the issue of AI technology noted in this device, which really raises the question about resiliency and mastery. If devices are empowered by AI and they sense what you need and deliver the appropriate electrical stimulation automatically, will this increase or decrease your longer-term capacity for regulation? Or does regulation then become the job of the machine? Will your brain become more adaptive, or will you lose capacity according to the adage, use it or lose it? And these are unanswered questions with some of the devices coming onto the market. And then we have brain-level interventions. The idea here is to change brain function, for example, to treat depression or OCD. However, when there is stimulation of brain regions linked to the autonomic control, an increase in heart rate variability can be a flow-on effect. So you can see that a lot of clinicians, both medical and non-medical, are trying to harness the healing properties of the parasympathetic system using different technology. So why is the parasympathetic system and heart rate variability such a big deal? And it's a big deal because parasympathetic dominance, more of the blue, is associated with health and well-being. So in the body as a whole, it yields lower arousal, that is more efficient energy use, and an easy flow of life processes, and the dampening down of inflammatory processes. In the heart, it yields lower heart rate, so decreased stress on the heart, and an increased capacity for the heart to respond to the challenges of daily living, and increased heart rate variability, so increased flexibility. In the gut, it yields digestive processes running as usual efficiently in the background. At night, it prompts good sleep and cellular repair functions. In the interpersonal domain, it supports the capacity to stay calm, playfulness, connection, exploration. In the mental health realm, it yields a sense of mental calm that allows for better executive function and emotion regulation, and a brain state that promotes safety-related cognition. Sympathetic dominance, on the other hand, is associated with defensive responses, and if maintained over time with a shift away from wellness. So increased arousal, so greater use of energy, increased burden on the heart, decreased cardiac capacity to respond, hypervigilance for danger, activation of inflammatory processes, disruption of executive function capacity, and a shift to more automatic modes of responding and danger-related cognitions, disrupted sleep. So in the normal course of events, when we deal with the challenges of daily living, we activate our stress system to increase available energy and implement the necessary defensive actions, but then we go back to baseline. Trauma shifts most of us away from parasympathetic dominance into sympathetic dominance. In the face of trauma or cumulative stress, we need to activate the body's defense systems. And sometimes these systems do not go back to baseline, or they stay activated or become dysregulated. So, for example, in girls who've been sexually abused, there's increased sympathetic activation, more of the red over time, coupled with dysregulation of the HPA axis, indexed by cortisol in yellow. And another example, in childhood PTSD, there's a prospective association between elevated heart rate post-trauma exposure and increased risk of PTSD persistence. With time, some children develop lower heart rate variability, and some experience increased baseline cortisol levels after the trauma and then lower baseline cortisol levels in adulthood, akin to what you saw in the sexually abused girls. And this slide is there to remind you that cortisol is a key player in epigenetic programming. When cortisol levels increase in the context of trauma, we can expect long-term epigenetic reprogramming changes across the various tissues. For example, neuroplasticity changes in the brain. So even if cortisol levels renormalize, reprogramming of set points may already have occurred. And this slide reminds you that it's the brain's job to regulate all body systems, including the autonomic nervous system. The brain functions as a predictive engine. It anticipates body needs and switches settings on ahead of time. As we just noted in the previous slide, the brain continues to be updated via neuroplasticity mechanisms, but this updating process may go awry. Neuroplasticity changes can be adaptive in the short term, but maladaptive in the long term, thereby supporting a range of physical and mental health symptoms. So, for example, responding to a trauma memory with extreme arousal, which manifests as a panic attack, every time is a really good example of a maladaptive process in the long term. So I think you get the point. Following cumulative stress or trauma, some people activate or dysregulate one or more components of their stress systems. An activated or dysregulated system supports stress-related symptoms that may be physical or that may be psychological. The autonomic system is one of the systems that can dysregulate. And heart rate variability provides a particular lens, a small glimpse into the brain-body stress system and the process of regulation. I use the word glimpse because it cannot be used to understand the system as a whole. Now let's hone in on the physiology of the heart. The heart has an innate pacemaker that runs the heart at 100 beats per minute. Fine-tuning of heart rate occurs via the parasympathetic fibers to the heart that run in the vagus nerve and via sympathetic fibers to the heart that run in the sympathetic chain. Both inputs are activated all the time, and between them, they coordinate heart function. When activated, the parasympathetic fibers slow down the heart, the vagal brake. If the vagal brake is withdrawn, the heart can speed up to 100 beats per minute, the rate of the innate pacemaker. So right now, your vagal brake should be on and your heart rate should be less than 100 beats per minute. When activated, the sympathetic fibers increase heart rate beyond 100 beats per minute, the rate of the innate pacemaker. So when you run up a hill and your heart rate hits 140, you're activating your sympathetic system. With each breath in, your heart beats a little faster, sympathetic effect, and with each breath out, it beats a little slower, parasympathetic effect. And the measure for this is called RSA, respiratory sinus arrhythmia. It measures the difference between heart rate during inspiration and expiration, and it's one of the measures of heart rate variability. So what is heart rate variability? In a healthy heart, the time between consecutive beats constantly fluctuates. Heart rate variability refers to the variation in time between each of your heartbeats. Higher heart rate variability reflects increased parasympathetic activity. Higher heart rate variability supports calm and overall well-being of the human system. More variation, as you see in the green tracing, is better for health and well-being. For this reason, heart rate variability is seen by many as a proxy measure of health and adaptation to stress. Less variation, as you see in the red tracing, is less good. And as I have already noted, heart rate variability is often used as a proxy for the parasympathetic activity in the body as a whole. But this makes some scientists very cranky because it's an oversimplification of a complex system. Heart rate variability information is more limited. It provides information about rhythmic changes in heart parasympathetic activity modulated by respiration. The metrics used in heart rate variability research are really confusing. Every one of these metrics measures heart rate variability, but it does so through a different lens. So think of it as mathematicians having a great deal of fun. Let's do it this way. No, let's think of it in this way. No, what about this way? And the slide summarizes the different lens. So during this talk, I just talk about heart rate variability. But if you look at the literature, you'll have to battle with these metrics. Using a cheat sheet, like what I have on the slide, is really helpful. And if anyone has technical questions, Darius Roundtree Harrison from STARTS is the man to ask, and he can be emailed after this talk. So because heart rate variability terminology is so confusing, there's a current proposal to replace the term respiratory sinus arrhythmia, which makes it sound like you have an illness, an arrhythmia, with the term respiratory heart rate variability. I think this term is more straightforward. It refers to respiratory-related heart rate variations. Here I also want to point out that heart rate measures are unable to take into account all of the various confounders that can affect heart rate variability metrics. So the metrics remain mathematical estimates of heart rate variability. So this slide shows you some of the factors that affect short-term measures. And this slide shows you some of the factors that affect long-term measures. And short-term measures and long-term measures are not interchangeable. So really the key message is that the autonomic innervation to the heart is a complicated system, and that the heart rate variability metric is a mathematical estimate, the best we have. But these metrics are not clean or pure measures of vagal activity to the heart. Moreover, even though heart rate variability measures are often used as a proxy of vagal activity to the body as a whole, this generalization is at odds with the organization and functioning of the autonomic nervous system, which controls physiological functions in an organ-specific, tissue-specific, and context-dependent manner. So once again, just hold in mind that we're talking about approximate measures. Hold in mind the complexity of the stress system as a whole and the brain as the overarching predictive engine, regulation engine. The big picture is complex. Heart rate variability is a window into a complex system. And using it as a proxy for the body as a whole is a simplification. So many heart rate variability biofeedback tools use the construct of coherence, and Melissa Bate will give us a bit of an idea about this construct in her presentation. This slide gives you the more detailed technical definition. So breathing rate and heartbeat to heartbeat intervals are mathematically converted into waves that have specific frequencies. Coherence reflects how well the heart rate fluctuation wave aligns with the frequency of your breathing wave. A high coherence indicates that your heart rhythm and breathing rhythm are closely synchronized, creating smooth wave-like pattern. But for most of us, the lay explanation is easier to understand. Coherence is a physiological state of calm, well-being, characterized by efficient energy use and synchrony between body systems, with a particular focus on the respiratory and cardiac systems. And you have to train to get yourself into this state. And you do that by breathing slowly. And this slide shows you that the autonomic system and the respiratory motor system are coupled. When you intentionally slow down your breath, you can upregulate parasympathetic visceromotor output to the heart. And with training, you can get into a state of coherence. And this is possible because respiratory centers in the brainstem sit close to autonomic nuclei and modulate them. So we can add slow breath training to our diagram. This slide shows you that slow breath training, in particular when it involves breathing through the nose, may in and of itself modulate brain function via a different mechanism, independent of heart rate variability. In this case, it's the vibrations from the act of breathing in through the nose that create oscillations in the olfactory and limbic cortex. So yet again, I remind you that we cannot oversimplify. The body's a complex system and there's many mechanisms that operate in parallel. And some patients will not be able to slow their breath rate, as focus on breathing may trigger a panic attack. And I think our next speaker, Melissa, will mention alternative approaches, sometimes indirect, that you may need to adapt when using heart rate variability biofeedback. But notwithstanding all these technical problems, all ancient healing traditions and we clinicians in clinical practice today try to harness the innate healing properties of the body. And one of these healing mechanisms is the autonomic nervous system. We know that if we shift the autonomic nervous system towards parasympathetic dominance, including increased heart rate variability, we are increasing the likelihood of health and well-being and of healing. So there's a number of reviews looking at heart rate variability and psychiatric populations. This is my take on the data. There's strong evidence that all the disorders listed on this slide are associated with lower heart rate variability. So theoretically, heart rate variability interventions should be helpful in all these scenarios. Now let's hone in on some clinical data to get some nuance. There is some evidence that you'll do better with a heart rate variability intervention if your heart rate variability is lowish in the first place. And this study showed that veterans with lower baseline heart rate variability had a better PTSD treatment response with a breathing-based yoga intervention. On the other hand, veterans with higher or average to high baseline heart rate variability had a better PTSD treatment response with a cognitive processing therapy, and that was a combination of trauma processing interventions. So the message from this study is that when heart rate variability is compromised, then targeted treatments that augment heart rate variability are more likely to be useful. And the key problem here is the lack of population norms. So we have really nice norms for heart rate, for breathing rate, for blood pressure, for weight, but we don't have good norms for heart rate variability. And this is particularly a problem in pediatrics and old age medicine, where you would need norms across different age and sex bands. And once such norms are available, then new options for clinical monitoring using heart rate variability will open up. And this study from Elizabeth Skovron's lab reminds us that in children, the co-regulation component is important. So the research team looked at autonomic measures in maltreating and non-maltreating dyads. Across both groups, when a mother displayed lower heart rate in an epoch relative to her usual level, that is, she was more calm, the child displayed higher heart rate variability. And when the mother displayed higher heart rate, that is, more aroused, the child displayed lower heart rate variability. In other words, the child responds in physiological terms to the level of calm or level of arousal in the mother. Calmness evokes calmness, and arousal evokes arousal. So when working with children, a family-based lens where we help everyone calm down is really important. And the co-regulation element is a key one underpinning the idea of kangaroo care in preterm infants in PICU. So now let's return to clinical practice and take a look at some of the non-technological interventions that one can implement to access the health-promoting effects of heart rate variability. So as you know, we have slow breath training, the prolonged out-breath being particularly important in upregulating heart rate variability. So we can embed breath work into meditation, into movement meditation, into yoga. And if we include feedback about how your heart rate variability is going via a device, then this is called heart rate variability biofeedback. And you saw that before also. Then you have variations such as humming, chanting, the woo sound, and Tibetan singing bowls. And knowing about these naturalistic methods is really important because not everyone and not people in all places can afford machines. But all of us do have the capacity to engage in a meditative practice of some kind to harness the healing capacities of our own body. And all of us can inform patients who may not be able to afford something else about these non-expensive options. And if you're an avid reader, this paper titled The Breath of Life is a very nice read and a good review of the data. So during this talk, I have not mentioned the purple line, what I call the defensive vagus, that is depicted in this diagram. Heart rate variability metrics do not measure the activity of the defensive vagus fibers. In fact, the defensive vagus is usually dormant. When there is a threat or danger, it activates alongside the sympathetic, the red. And this slide shows you some of the clinical scenarios in which you may see physical symptoms caused by the defensive vagus in your work with traumatized patients. And if you want to know more about these scenarios, there's a few references at the bottom of the slide. And this slide shows you some of the lifestyle choices that are important in health and well-being, but that are also associated with increased heart rate variability. Good sleep, regular exercise, and you can see that even nutrients count because some of the breakdown products of food modulate the vagal nerve directly from the gut. And related to diet is the issue of weight management. In a nutshell, fat cells in the abdomen are associated with increased sympathetic activity, decreased vagal responsivity, and a pro-inflammatory state, a state of sympathetic dominance. So weight loss can be an important intervention for shifting away from sympathetic dominance. But Ozempic and other GLP-1 receptor agonist drugs increase heart rate, and studies have suggested that they may reduce heart rate variability. So the net effect on heart rate variability in people who use these drugs is not known. And these factors shown on this slide are also very important for all of us and our heart rate variability in this technological age. So that's it for me, and I'm going to stop sharing and allow Melissa to share her lovely clinical material.